Coronary artery disease is one of the most common heart diseases and is notable for its life-threatening risks. If it is not recognized in time and measures are not taken, it can lead to a heart attack. Changing the lifestyle with early diagnosis reduces the risk of the disease. Your heart functions as a continuous pump, meeting the blood needs of your whole body. To do this, the heart itself needs oxygen-rich blood. This blood is delivered to your heart through the coronary arteries. In short, the functioning of your heart depends on the blood supplied by the coronary arteries. You can think of the coronary arteries as the first branches of the aorta, the largest artery that distributes blood from the heart to the whole body. The left coronary artery and the right coronary artery branch off into smaller branches that supply the entire heart. When the lining of a coronary artery is healthy, blood flows freely through it. This ensures that your heart is supplied with the oxygen it needs. In case of activity, healthy arteries can easily meet the heart's increased demand. The inner layer of the artery may be damaged by high cholesterol, high blood pressure, or smoking. This results in plaque formation on the artery wall. Therefore, blood cannot flow as easily as before. This is the beginning of coronary artery disease. As plaque builds up, the artery narrows even more and the blood supply to the heart muscle is severely reduced. The heart becomes starved of oxygen, which can cause chest pain. If the narrowed artery is completely blocked by a clot, a heart attack myocardial infarction occurs. In the absence of oxygen-rich blood, the heart muscles in that area are permanently damaged. Coronary artery disease occurs when cholesterol-containing fatty plaques build up on the walls of the coronary arteries, the vessels that feed the heart, and over the years block the arteries. The process of fat accumulation in the vessel wall is called atherosclerosis. Gradual blockage of the heart vessel by atherosclerosis causes the heart muscle to be deprived of oxygen and leads to heart failure in the long term. The disease is more common in men. In fact, it is approximately 4 times more common in men than in women. Men over the age of 50 and women over the age of 60 are in the risk group. Family history of coronary artery disease. People with diabetes. Smokers. High blood pressure patients. Those with high cholesterol levels. Those with low physical activity. Heavy alcohol consumers. People experiencing extreme stress. Symptoms of coronary artery disease begin to appear as the narrowing, blockage of the artery increases. However, the symptoms may not follow a hierarchical pattern. The symptoms and severity of coronary artery disease often vary from person to person. In some people, the disease is asymptomatic and manifests itself as a heart attack, but in most cases, the symptoms begin to appear and gradually increase as the narrowing of the arteries increases. As the vessels narrow, blood flow decreases and the heart's nutrition begins to deteriorate. The symptoms of coronary artery disease are usually directly proportional to the degree of narrowing of the vessels. As the coronary arteries narrow, the blood flow to the heart decreases and the nutrition of the heart deteriorates. In some patients, coronary artery disease may manifest itself directly with a heart attack, while in others it may be manifested by more innocent complaints. What are these symptoms? Rapid fatigue when walking, climbing stairs and doing things that require effort, chest pain and shortness of breath. Chest pain may radiate to the arms, neck and jaw. Increases with exertion and decreases during rest. Stomach pain, eye burning, nausea. Back pain. Dizziness. Extreme thinness. Sweat. Patients diagnosed with cardiovascular disease receive 3 different treatment methods. These are drug therapy, percutaneous coronary interventions and open heart surgery. The most appropriate treatment method is decided by the patient and the doctor together. Drug treatment differs in patients with undiagnosed cardiovascular disease and those with diagnosed cardiovascular disease. Every cardiovascular patient should take 100 to 300 milligrams of aspirin every day. However, aspirin is not recommended for every healthy person. Aspirin is also recommended for people who have a 10-year probability of having a heart attack above 6%, even though they are only healthy individuals. Again, in primary prevention, it is important for patients to use their diabetes and blood pressure medications regularly. The criteria for starting cholesterol medications in primary and secondary prevention are also different. Other drug groups used are almost the same. Coronary angioplasty is a non-surgical procedure to open local narrowings in the heart vessels. A deflated balloon is inserted through the inguinal arteries, pushed into the vessels of the heart through a guide wire, slid over this guide wire, and placed in the area of stenosis and inflated with external pressure, and the blockage of the heart vessel is opened. Coronary artery bypass surgery allows the heart to be re-nourished by creating another pathway beyond the blocked or narrowed artery. In the case of multiple blocked arteries, more than one bypass procedure is performed. The vessels, or grafts, to be used for bypass are taken from the chest, heart or leg and connected to the blocked coronary artery. Commonly used grafts are the mammary artery from the chest wall, the aorta from the arm, and the vein from the leg. In endoscopic surgery, a minimally invasive technique, open heart operations can be performed through small incisions made in the chest area with special endoscopic devices. During the operation, the surgical instruments are completely under the surgeon's own control. A robot developed for surgery performs the operation under the guidance of surgeons. The main difference of robotic surgery from endoscopic surgery is that the surgeon operates the robot's arms by remote control while watching on a monitor. During the operation, the surgeon sits at a console slightly ahead of the table where the patient is lying, where he can control the operation. He takes images from this console and can move the arms of the robot. Accompanied by these images, the surgeon performs a difficult and delicate surgery by activating the other arms of the robot, which can move like a surgeon's hand.
You can support us by liking the video, writing your thoughts on the subject in the comments, and subscribing to the channel for the development of the channel and more such content.